External snapping hip syndrome is caused by excessive tightness in the structures on the outside of the hip, primarily the IT band. This is usually caused by repetitive activities such as running, going up and down stairs, going hiking where you're climbing hills or going down steep declines. So that repetitive motion will cause tightness in the IT band to the point where it actually pops over the bone on the outside of the hip, and that will create that kind of snapping or popping sensation. Real quick, for those of you that don't know already, the IT band runs from the top of the pelvis over that outer hip bone, down the outside of your thigh, and inserts into your lower leg just below the knee. We first want to work on reducing the tightness and improving the flexibility of the IT band, so we can do this in a couple ways. The first way is getting a massage roller. Now there's a whole bunch of different kinds. I like the ones that have these kind of separate little rollers on them. They're really kind of flexible. They can kind of bend slightly around the leg. So basically what we're going to do is sit in a chair, turn your leg slightly inward, which exposes that IT band that runs on the outside of the thigh. Start below the hip bone, because we never want to roll over top of the bone. That can aggravate the bone and cause other kind of inflammatory issues. So we want to start below that hip bone on the outside, press in gently, and then roll down the outside of the thigh. And we're going to look for any spots, those little speed bumps that you kind of feel underneath there, any of those tender, tight spots. We want to find those and then slowly kind of work them out, just like you're making some cookies or something, or rolling out some dough. So just kind of roll back and forth. And you're going to go all the way down to just above the knee, looking for those spots, and then spend 3 to 5 minutes working on this. You know, kind of hit the front a little bit, hit the back side a little bit, so we're getting that whole area, kind of improving the IT band tightness. Okay, so our first flexibility stretch is going to target the outer hip muscles. It's called a pigeon stretch, one of my personal favorites. You'll either be on like your bed or down on the floor, maybe on a yoga mat or a carpeted floor would be fine. But what you'll do is take one leg, turn it outwards so that the knee's kind of coming across your body. Place one hand on each side of the knee, and then line your knee up so that it's in line with the center of your chest, because what you'll do is lean your chest down, almost laying the chest directly on the knee until you feel a really good stretch in your outer hip. So right now I'm feeling a great stretch in my right hip muscles. You'll hold there for 30 seconds, just like any other muscle stretch. And then we'll do 3 repetitions. Now, if you can't get into this position, because I have patients all the time that just, they're so tight they can't even get into this starting position, you'll go to the modified position. And the modified position is where you drop your leg. So I'm going to take my left leg, drop it off the table or the couch or the bed, and then bring that knee again to the center of my chest and start to work my way down and find that good stretch for 30 seconds. So it's really important that we strengthen our hip muscles, because those hip muscles help support that IT band and they reduce the stress on the IT band over time. So our first strengthening exercise is a side-lying hip abduction, that's ABD. And it basically starts out by lying on your side with your bottom leg bent, your top leg straight. It's really important that you look down your body. You want to see a straight line all the way down your leg with your toes kind of pulled up and pointed straight ahead. A lot of people will cheat this because they have weak hip muscles and they'll bring that leg forward to do it, but that's actually going to overactivate the hip flexors. So we want to, again, look down your body, make sure it's a nice straight line. Whenever you lift your leg up towards the ceiling, you make sure that the foot stays pointing straight ahead. That's really critical, okay? So take a look down at it, make sure the foot's pointing ahead. People will cheat this part of it by rolling back. They'll roll their hips back, they'll point their foot up towards the ceiling. Don't do that. Keep it pointed straight ahead. And as you lift up, you'll start to feel it in that outer glute muscle. So if you're not feeling it there, then you're not doing it right, because this is a really tough exercise. You should feel it pretty quickly. You're like, oh yeah, I'm feeling that outer hip working, so I'm doing it right. So you'll do 3 sets of 10. Our next exercise is a side-lying clamshell. And again, this one is targeting those hip muscles. So start by lying on your side, kind of in a fetal position, where both knees are bent and stacked. Basically, you're going to keep your feet together as a hinge point, lift the top knee up towards the ceiling, so you're opening up like a clamshell kind of. And every time that you lift your knee up, I want you to squeeze your upper glute. So squeeze your glute hard, because that's the muscle group that's directing this movement. And we'll do 2 sets of 15 repetitions, so a little bit more. And now if this exercise is just too easy for you, then you can take one of the resistance bands, the stretchy bands, and put the loop just above your knees, so that as you open your knees up, you've got a little bit of resistance there. So that's just one way to advance this one. Let's move on to our next exercise. So this is going to be a bridge exercise targeting both glutes. You can start off with both legs. I like to pull my toes up because that helps emphasize my glute activity over my hamstrings, because we're really trying to target the glutes more than the hamstrings. So pull both toes up. You'll press through your heels and lift your hips up towards the ceiling, getting a nice glute squeeze. So we can start off with 3 sets of 10 of the regular bridges. Now, if this is too easy for you, you can move on to a single leg position where you pull one knee up into your chest and then drive up just on one leg. So this is a single leg bridge. Again, you would just do 3 sets of 10. The next strengthening exercise is a tandem stance, sit to stand exercise out of a chair. So basically you sit in a chair at the front edge of a chair, take both feet and then put them in a kind of a tandem stance position. So one foot is forward and you're kind of putting your weight on the heel. That's basically for balance assist. The other foot is underneath you and flat. So when I go to stand up, most of my weight is going to be on my right leg, so that's the side that you want to have the snapping hip on, because we're targeting the strengthening on that leg. So cross both arms, lean forward until you feel your weight on that back leg, and then drive up into a stand position, and then control sit back down. So make sure you're not just throwing your weight, right? We're not trying to use momentum. We're trying to strengthen here. So lean forward, drive up, and slowly sit back down. Now, if having your feet, the further apart your feet are, the harder it will be. So if that's just too hard, just bring that front foot in closer to you, because that more evenly distributes your weight, and that'll be easier. So you can just kind of adjust it to whatever difficulty you need to do. But you'll do 3 sets of 10. Our next stretch is a kneeling hip flexor stretch. So you'll place the stretch leg down, so kneel down on the ground, pull your toes up underneath you, place both hands on your other thigh with your foot out far enough in front that the knee is over top of the foot, it's not out in front of it. So both hands on the thigh, look straight ahead, hips are square, press into your thigh. That's important because when you press into your thigh, it engages your core, and then keep your chest up as you shift your hips forward. And you're going to shift your hips forward until you start to feel a stretch on the front part of the thigh, kind of close to the hip and the quads there. So you're getting that hip flexor and quad stretch. So again, press into your hands to engage the core, keeping your chest up, shift forward until you feel that moderate stretch. Hold for 30 seconds and then relax, and you'll do 3 repetitions. One of my favorite ways to address that IT band tightness is using a foam roller. So if you check the description below, I'll add my favorite foam rollers down there for you to check out. But you'll lie on a foam roller on the ground, have your other forearm down on the ground and your top leg with your foot in front of you, and that distributes the weight between your arm, your leg, and your other foot. So especially if you're a beginner, this is going to be painful because your IT band is going to be very tight. So just understand that in the beginning, it is painful because it is tight, and whenever you reduce that tightness, the pain will get better, I promise. So start below the hip bone, so that outside hip bone up here. Don't roll over top of the hip bone, you start below the hip bone, and we're going to go and roll the outside of this thigh to just above the knee. So I'm going to start to slowly roll down the outside of my thigh. I'm going to kind of walk my foot and my arm. And what you're looking for are those speed bumps that you hit that I mentioned before. Those speed bumps are little tight adhesions in the muscles and the fascia. And so we just want to kind of find those wherever it's tight and tender, just little knots. We're going to roll back and forth over those areas to reduce that tension. We're going to reduce that tension and improve the flexibility of that IT band. And you can even roll the leg back a little bit to get that back outer side a little bit more. You can roll forward a little bit to get the front side a little bit more. Just search that whole area and spend about 3 to 5 minutes on each side working on that IT band mobility. If you do have any questions, make sure you drop them in the comments below. Next, you'll definitely want to check out my best hip stretches video. Thanks for stopping by PT Time with Tim, where we restore to explore.